Inflammatory Breast Cancer Foundation presents IBC, Facts and Fallacies, What Your Doctor May Not Know. In today's world, the internet is used by so many. Research is at its fingertips of just about anyone on subjects they may need to know more about. But the challenges of knowing the truth versus fiction about health issues are a major concern for the public and the medical community. With all the hurdles many women face when they may have the symptoms of IBC, and the doctors who seemingly disregard their pleas to rule it out, this show will attempt to educate everyone and help differentiate between what really are facts and what are fallacies. And now, your hosts for tonight's show.
Evening, everyone, and welcome to our show. We are so very glad you could join us for our special evening with our special guest, Dr. Kathleen Ruddy. But before we talk with her, I want to remind our audience that this week marks 5 years since Katrina. I know this doesn't really have anything to do with IBC, but in the last few days, I've been watching the replays of what happened in New Orleans during that terrible hurricane in August of 2005. And I realized that there are some very striking similarities to our own problems within the community of communication when a woman tries to circumvent the system, trying to gain knowledge after a diagnosis of IBC. So I personally went on a journey to find information just this week, acting as a private party through government channels, trying to access information to find doctors or clinics that I know are there that specialize in IBC, which the last time I looked was still considered a rare disease. I have a computer like many people have, but even with that advantage, it was a maze, a total maze that was insurmountable and left me very frustrated. Then I got on the phone, as many people who don't have a computer would do, use the old telephone, and tried it the old-fashioned way, calling federal agencies who purport to have spent millions of dollars to make sure all people have access to the very facilities I was searching for. From the National Institute on Health to the Office of Rare Diseases, I ended up in my own state of Washington with the Department of Health, always asking the same question. Can someone please tell me where I can find a listing for doctors or clinics that specialize in inflammatory breast cancer? And of course, many times I had to spell out inflammatory. I was told there was no such place. Two things struck me as very frustrating, and I might say very sad. Number one, it was women who were answering every phone number that I called. Not one of them said anything about possibly calling a local hospital and talking to the oncology group, or even acknowledge that I, the caller, needed help, and that maybe they might go above and beyond to help me in my quest. Not one. Number two, I was shocked in the end when, after giving up on all the federal telephone numbers I'd called, I called the American Cancer Society and was given our own foundation's telephone number to call to talk to someone. Very, very nice to know that the American Cancer Society has us listed as a resource. But where are all the federal dollars and even private dollars that we all hand out to all these huge associations that race for the cure? I wasn't even directed to them. Just like Katrina and the devastation after September 11th, 2001, when local authorities like the FBI and the CIA were not talking to each other, we have the same problem with access to information that we repeatedly are told is just at our fingertips. It's not. There is a large chasm that has to be filled of disconnected authorities who don't have a cheat sheet, well, shall we call it, in front of them to direct the citizen to the right location. With clinics springing up all over our country that specialize in IBC, I shouldn't say all over the country, there's 4 as we speak, you would think that someone would have known the names of hospitals at least to give me, but they didn't. And this isn't acceptable. It'll be a daunting task, but we as a foundation are going to try to change that. Cross your fingers, light a candle, or whatever you might want to do, and pray we are successful. This should not take a rocket scientist to figure out that in this day and age with computers and telephones, so I pray we can make a dent, or should I say a wave, and change what seems to be disconnected, because just like Katrina and this puppy in my lap that's driving me nuts, sorry, just like Katrina, when the powers that be couldn't move fast enough, our community of IBC diagnosed women and their caretakers must try to change this monolith of miscommunication, because it is huge. It's amazing. This is a cause that should have everyone put their thinking caps on, and I hope the people that are listening tonight can help us out. We need ideas. On a personal note, I've been at the proverbial brick wall with my imaginary soapbox for 7 years. 7 long years, trying to get the system to listen to our pleas. And I hope all of you listening tonight will join me in trying to break through this maze that can save lives by finding the right facilities to give women and men the very tools that they need to fight this disease. Thank you very much for listening to my editorial. Sorry it's a little bit emotional, but I got very involved in it. In 3 days, very involved. We are going to go through for our show tonight. I'm really looking forward to talking with Dr. Ruddy. And after our break, we'll be speaking with her and about her passion to find the answers to her burning question. Could a virus cause breast cancer? We will be right back after a few minutes, so please stay with us.
Don't go away. We'll be right back with IBC Facts and Fallacies after a few short messages.
Remember the time you almost volunteered to work in a soup kitchen? Or when you almost visited the Veterans Hospital? Or when you almost brought dinner to your neighbor with AIDS? Remember all the times you almost helped, almost gave? Well, it's only human, this almost giving. But the truth is, it's the same as not giving at all. Don't almost give, give. Visit our website at don'talmostgive.org. A message from the Ad Council.
I can listen.
I can cook.
Good. I can coach.
Kids with something to do are less likely to do drugs.
I can drive.
I can paint.
I can dance.
A little of your time can make a lifetime of difference.
I can read.
I can help.
You can help. Call toll-free 1-877-KIDS-313 to find out about community drug prevention programs.
I can keep a kid off drugs.
You put your keys between your knuckles. You walk in well-lit areas. Someone approaches you and you grasp your cell phone tightly, ready at any second to dial the number for help. You lock the door behind you, once, twice, maybe 3 times. Now you feel safe, secure. You think you've made the right choices to protect yourself. Think again. Because if you're not making healthy choices, you could be one of the nearly 2 out of 3 women killed by cancer, diabetes, heart disease, or stroke. So eat right, get active, don't smoke, see your doctor, and live. Learn to protect yourself from yourself at 1-866-399-6789 or visit us at everydaychoices.org. A message from the American Cancer Society, American Diabetes Association, American Heart Association, and the Ad Council.
And now, here is Patty.
Hi, everybody. We're back. Hey, Peggy. I just rolled off and didn't even say good hello to you tonight.
Hello.
How are you?
I am good.
I'm just going to let Dr. Ruddy roll on this because she's got a lot to say. Good evening, Dr. Ruddy.
Hello
Welcome
there.
back.
How are you?
I'm great. How are you?
I'm good.
Dr. Reddy is a breast cancer surgeon, and she has a very different story to tell, but I'm going to let her tell it. You've got
Well,
the
actually,
floor.
I don't know that it's so different, Patty. I think it's,
It is to some
the same
women.
song, a different verse in a way. And, the song is, why is it taking so long? Why aren't we farther down the road? I mean, we're smart people. There are 300 million of us. Surely we can do better than this. My particular perspective as a breast cancer surgeon is that despite the fact that we've got lots of ways to treat breast cancer, many of them very good and successful, we haven't really done everything we can do to understand what's causing the disease or work hard to try and prevent it, so that the preponderance of our attention with regard to breast cancer is to try and make an early diagnosis and to try and treat it rather than try to prevent it. Now, let me put this into perspective in terms of dollars and cents. Approximately $50 billion a year is spent treating breast cancer. $50 billion. Another approximately $1 billion is spent by breast cancer foundations for breast cancer research or awareness, outreach, education. Less than 2% of the money spent on breast cancer research, less than 2%, is spent either trying to understand what's causing it or trying to prevent it. This, despite the fact that at least 30% of breast cancer is preventable using known risk reduction strategies. So we know how to prevent 30% of it, and yet we're spending less than 2% trying to do so. We're spending $50 billion treating it. If we could figure out what is causing breast cancer and stop it, we could save $500 billion in 10 years. A lot of money. This is not a small amount of money. Not to mention saving 500,000 lives, 500,000 lives a year, deaths from breast cancer, and sparing 1.4 million women this year from ever getting the disease. So
that's a lot of money.
Yeah, I understand your frustration at having reality in one hand and being completely befuddled on the other.
And I knew what I was looking for. I was just pretending that I didn't.
Yeah, right. So, on to the virus. It turns out there is good and compelling and converging data to suggest that at least 40% of breast cancer is caused by a virus. In the case of inflammatory breast cancer, it looks like 75% of inflammatory breast cancer may be related to a virus. Now, this is more than just theoretically interesting, because if we can prove that a virus does cause breast cancer, then we can begin to develop a vaccine to prevent it entirely, and we can design new